Hi everyone, welcome to researchentity.com. We got another great presentation today. We're going to talk about biostatistics today. We're going to teach you all about sensitivity and specificity today. My name is Pramil Cheriyath. I'm a program director in internal medicine residency program, transitional residency program. I teach medical students and medical residents. I'm also director of research and assistant professor of medicine at two major universities. So let's get into our subject. So why is it important? You know, when you order a test, you want to know how accurate that test. So when sensitivity and specificity play a very important role in it, right? If you don't have the increased sensitivity and specificity, you should not ordering like tests which have like low sensitivity and specificity. Okay. We can say it's about the validity also. Now just go into like sensitivity. What is sensitivity? It's the ability of a test correctly identify with the disease. Sensitivity is the percentage of true positive. Okay, let's say if we have a test 99% sensitivity, that means if you order that test, if that test come back negative, most you can pretty much completely say that person don't have the disease. Okay, so sensitivity is the percentage of true positive. The example, 90% sensitivity means 90% of the people who have the target disease will test positive for it. So high sensitive test will lead to positive finding for patient with the disease. Okay, so sensitivity is the ability of the test to correctly identify patients with the disease. So you can say snout. I mean, if you want to, like a mnemonic, if you want to remember, it's a high sensitive test. When negative, rules out the disease. Okay, remember the mnemonic. Snout, high sensitive test. When negative, rules out the disease. A diagnostic test with the sensitivity closer to 100% desirable to rule out the disease. So if the test results come back negative, we can say pretty much you don't have the disease. Okay, so it is used for a screening test. Always that when you ask a question for any examination, high sensitivity test is used as a screening test. Okay, now the formula, let's get into the formula. First you make this 2 by 2 table, right? The disease positive negative on the top and the test positive negative on the left, and then you look at the true positive, true negative, and false positive and false negative. So what is the formula to calculate the sensitivity? Sensitivity is true positive, and you divide that by true positive plus false negative. So that's the sensitivity. There's another way also you can calculate. How do you do that? You take the percentage of the false negative, 100 minus percentage of the false negative, that also give you the sensitivity. Okay. Now, let's look at specificity. What is the definition? Ability of the test to correctly identify people without the disease. Okay, so specificity is the percentage of true negative. Let's say if it's a high specific and you order the test, if that test is positive, most likely that person have the disease. That's the way I look at it. So specificity is the percentage of true negative. 90% specificity means 90% of the people who do not have the target disease will test negative, and high specific test will show patient without a finding having no disease. Okay. Now, so again, mnemonic, spin, you can use it. High specific test, when positive, rules in disease. Always remember that. Okay. And so if you have a diagnostic test with a specificity closer to 100%, it's desirable for ruling in disease and also indicate like a low false positive rate. Remember that. Therefore, so it's used as a confirmatory test after a positive screening test. So high specificity test is a confirmatory test after a positive screening test. Also remember that. So let's go into our formula. You make the table, disease with the positive, negative on the top, on the left side positive and negative, and you label true positive, false negative, and true negative. So what is the formula for specificity? You take the true negative divided by true negative plus false positive. And then you can also do another calculation. You take the false positive, the percentage of false positive, okay? 100 minus false positive percentage will give you specificity also. So now we're going to take a look at an example. In a total, you have 300 people, right? If 43 out of 100 people known to have disease were tested positive, and 120 out of 200 people with no disease were tested negative, then calculate the sensitivity. Please stop the presentation, and if you could make the 2x2 table and do the calculation. I'm going to give you a few seconds. Okay, let's move on. So first thing we have to do the solution. You put the disease on the top, positive, negative, and the test on the left side, positive and negative. You put the number 43, 80, 57, 120. You do the total, and you bring in our formula, which is sensitivity equals true positive divided by true positive plus false negative. Okay, that is 43 divided by 43 plus 57. 43 divided by 100, so you get 43%. So sensitivity of this test is 43%. Okay. Now let's look at another example. In a total of 500 people, if 100 out of 200 people known to have a disease were tested positive, and 200 out of 300 people with no disease were tested negative, then calculate the specificity. So in this thing, we calculate the specificity. Okay. Just pause the screen. Let's do the table and do the calculation. Okay, so let's look at our answer. Your solution in disease, again, positive, negative on the top. On the left side, you put the test, positive and negative. So you got 100, 90, 100, and 210. You add it up, you get the total. And let's bring in our formula. What is it? Specificity equals true negative divided by true negative plus false positive, which is 210 divided by 210 plus 90. So equals 210 divided by 300, which is 70%. The specificity of this test is 70%. Now let's look at another example. In this analysis, a new diagnostic test was found out of 500 diseased and 500 non-diseased patients. The test measured 30% of diseased patients are false negative and 10% are non-diseased patients as false positive. They calculate the sensitivity and specificity of the new diagnostic test. Remember, they're putting the percentage over here. Now you have to calculate. You have to use the formula. We use the percentage, right? So I'm going to please pause and make the table and do the calculation. All right, let's look at the solution for this. Okay, you put the disease positive, negative on the top, on the test, positive, negative on the left side, and remember, you're plugging in the percentage over here. Okay, so sensitivity means 100 minus false negative percentage. Okay, so 100 minus 30, that is 70%. And then you do the specificity, which is 100 minus false positive percentage. Always you have to put that in your brain. Now we're using the percentage. So the different formula, 100 minus false positive percentage, that's 100 minus 10, then the 90%, so answer is specificity 100%. Okay. In summary, we put the, and again, the whole formula right here. Sensitivity is true positive divided by true positive plus false negative, which equals also 100 minus false negative percentage. And the specificity is true negative divided by true negative plus false positive equals 100 minus false positive. Okay. Again, thank you so much for watching. Please continue to subscribe our channel. Greatly appreciate it. Thank you.